The Ebola epidemic started in December of 2013 with an 18-month-old boy who lived in Malandu, Guinea. He developed symptoms indicative of an illness including fever, vomiting, and black stool, followed by death 2 days later. Fast forward to January of 2014, members of the boy's immediate family, people who helped treat him, and those who attended the boy's funeral all suffered his same fate after developing similar symptoms. This rapid development and spread of the mysterious disease triggered an outbreak investigation. In this video, we are going to analyze 8 components of an outbreak investigation using the 2014 Ebola outbreak as our guide. The first component is to verify the diagnosis and confirm the outbreak. On March 23rd of 2014, the World Health Organization's laboratory confirmed that the causative agent was the Zaire species of the Ebola virus family. Blood and oral samples were collected from suspected Ebola patients who were being treated in Sierra Leone's western area and northern Providence. A 1-tube reverse transcription PCR assay for the identification of Ebola virus was developed and evaluated using the ABI PRISM 7700 sequence detector, which confirmed the outbreak was the result of the strain Zaire Ebola virus, which causes the disease Ebola. Number 2 is define a case and conduct case findings. Confirmed Ebola virus disease patients were defined as persons, dead or alive, with suspected Ebola disease whose samples were confirmed to be Ebola virus positive by laboratory testing. In June of 2015, a total of 27,443 cases were reported, although case numbers were believed to be underreported. Next is data about people, place, and time. During the outbreak, a routine World Health Organization case investigation form was completed for each person under investigation, which included demographic info and info regarding the disease, including signs and symptoms, hospitalization, epidemiologic risk factors, and exposure to Ebola virus. The fourth component is immediate control measures. Immediate responses to the Ebola outbreak included deploying multidisciplinary teams to detect and manage cases and trace contacts. Medical teams that specialize in infection prevention and control were also deployed to hospitals and outbreak areas. Next is formulating and testing a hypothesis. Many hypotheses were formed and tested during the Ebola outbreak. Initially, scientists had no idea, but connected the illness to wild animal exposure. Next, they thought it was cholera by comparing symptoms. Then the World Health Organization suggested Lassa fever. On March 21st, it was narrowed down to either Marburg or Ebola virus. And finally, on March 23rd, it was confirmed to be Ebola. Next, to evaluate control measures and implement additional control measures if needed. Other control measures taken during the Ebola epidemic included case management, infection prevention and control practices, surveillance and contact tracing, good laboratory services, safe and dignified burials, and social mobilization. The last 2 components I'm going to mention are planning and executing additional studies and communicating findings. I grouped these together because they kind of go hand in hand. Here I've listed a few major health organizations that have all conducted additional studies and posted their research on the Ebola virus for the public to access. While no cure has been produced yet, a vaccine has been developed and approved by the FDA. Thank you for watching, and I hope you learned something new.